looking for 180 degrees of glenohumeral flexion. Now, you want to keep in mind that there is scapular recruitment anytime you're going into full range in glenohumeral spin. So we want to watch the scapula, we want to see what it's doing. Our goal in this weekend is not to assess scapular motion, but by default we will get some of that just through glenohumeral movement. But we are looking for 180 degrees of range. Fantastic, right? Very easy. No inhibition, no catching, no pain, right? 180 degrees all the way to the ear, right? Back to 0. And then we want to be able to see 45 degrees of glenohumeral extension, right? Which is about here. That's a lot to ask of people. Josh can easily hit 90. Now, we talked about this, right? You're going to get some people where your expectation may be more 90 degrees, right? 45 is sort of a standard, like we want our average person to be able to get there. And you get a lot of people who will not. They'll get here and they're done. If you go any farther, what you're going to see is the scapula start to recruit into anterior tilt. And then you're done. You're not getting any glenohumeral spin anymore. You're cheating the movement. See, but Josh's scapula stays pretty clean all the way through, right? You don't see that lifting of the scapula. Trust me, you will see it in a lot of people, okay? So 180 degrees in flexion, 45 degrees in extension. If they get pretty clean, you can exceed that expectation to the 70-80 range, kind of like we did with abduction, right? Just make sure they're getting nice, clean extension. Anything beyond 90 would be certainly hyperbole, okay? All right, so at 0 degrees, there is really no assessment for adduction. You definitely get people that complain of being able to go across the body, like horizontal adduction and stuff. But again, we're looking just at the 6' movement. So as far as pure adduction, 0 degrees is 0 degrees. And that's all we need. But abduction, we're looking for 180 degrees again. So again, we are asking for inferior spin of the glenohumeral joint. We're also asking for upward rotation of the scapula, right? So right there with Josh, you get a little bit of internal rotation. Probably not a big deal, but definitely something to notice. And you see how his arm wants to lift up a little bit. So a little bit limited in that, right? We'd like a clean movement here, but see, you can see the rotation in his glenohumeral joint right there. And it wants to, so, you know, maybe some issues with lats, teres major, could be some subscap stuff going on. Anterior deltoid, something driving that humerus into internal rotation. Okay? So we had 180 degrees of flexion, extension back to 0, 45 degrees of hyperextension, okay? 180 degrees of abduction, okay? Back to 0 degrees. Now if you want to scoot slightly back towards the midline, all right? From here, we are looking for internal, external rotation, so we can bring the arm out at 90 degrees, so we're checking internal rotation. Internal rotation, we want about 85 degrees, right? Just shy of 90. Josh gets that just fine, almost 90 degrees, right? Very easy. Starting to pull on that scapula a little bit, so maybe some external rotation tension, right? And then we go to external rotation, 90 degrees, easy, no problem. All right? Your average person will not be able to do the external rotation piece. Most people are very, very tight through subscap. Again, lats, pecs, these are big ones that people struggle with. Josh has obviously done his work and he's able to get 90 pretty easy. In fact, his limitation in internal rotation is actually pretty unusual. You will see more limitations in external rotation, but again, the lack of internal rotation would draw us to muscles like infraspinatus, like teres minor, like posterior deltoid, right? So. And you'll see that sometimes, but again, you're probably going to find external to be more of a problem in motion. Okay? So, those are all the range assessments for glenohumeral joint. I think we can go to active, right? That's not that much. Y'all can handle that plus some active. Good. Great.